Hello, and welcome to session 4, Advocacy and Marketing Strategies, Becoming the Long-Term Care Hero. My name is Debbie Miller, and I will be your instructor for this session. And as many of you know, I am the founder and CEO of 52 Weeks Marketing. And like many of you, I'm also a home care provider. Well, I used the 52 Weeks marketing system to grow my agency from the ground up, and I continue to use it today because it works. In this session, we'll dive into marketing strategies for long-term care advocacy that are really going to help differentiate your agency in this competitive market. I'll be incorporating many elements of the 52 Weeks methodology throughout this session, which are going to focus on practical, actionable steps that you can take to implement your marketing program. So let's explore how long-term care advocacy can be a powerful marketing tool to help you build trust with families and form strong referral partnerships. So get ready to tap into new opportunities and grow your business with confidence. All right, well, here are our learning objectives for today. We're going to develop skills to advocate for your clients and families during the long-term care process. You'll learn how to educate referral sources and families on the benefits of long-term care insurance for home care, and learn how to position yourself as the long-term care expert and advocate. And then ultimately, you'll know who to target and with what message to grow your business by offering long-term care advocacy services. All right. Well, in session 1, we talked about the growing need for care. And as we mentioned, 70% of seniors will need assistance at some point in their life. However, only 20% of older adults can actually afford that care. And so as a home care provider, we are going to be able to tap into this incredible opportunity. And I wanted to share with you the impact that focusing on long-term care insurance and presenting my agency as an expert in this arena has helped me to grow my private pay business. So I am giving you a snapshot of how we've generated revenue with this program over the course of, under 10 years, I guess. And again, this is just my long-term care revenue, okay? This doesn't include my private pay, but this kind of fits within my private pay piece of my portfolio. So in 2016, I started to really recognize that there's an opportunity with these policies. And so I began to educate myself and learn as much as I could about these policies and how to help my clients. There were several situations where my clients ran against and hit a wall in dealing with the long-term care insurance companies and weren't able to utilize their policy. In fact, I, on several occasions, got the insurance commissioner involved because of the treatment of these poor seniors who'd spent all this money on these policies and just got the runaround from the insurance companies. And that really helped them. So, of course, with our advocacy program, you're going to be able to be able to set them up for success earlier on in the process so they don't run into some of those issues. But look at the impact that this has had on my business. So as I got to really get out in the community and educate and position myself as this expert, you can see the impact that it's had on my revenues year over year. Now, you see, we stalled a little bit there in 2021 and 2022. That was COVID. We weren't able to get out as much and be marketing the program. And in fact, we lost several clients to death due to COVID of our long-term care clients. But we were able to get a couple more going and maintain that level of revenue. And then back in 2023, we just ramped things back up again. And in 2024, you see we're around $3.2 million in long-term care revenue. So I wanted to show you that this is definitely possible and this can have an incredible impact on your business. And just articulate again how important it is to have as many payer options as possible in your portfolio so that you can diversify. And certainly, as I mentioned in session 1, not all of you are able to diversify in terms of Medicaid or being credentialed with the VA. Everyone can take advantage of the long-term care policy opportunity it presents to home care. All right, so where there are challenges, there are opportunities. And let me tell you, the complexities surrounding long-term care insurance present a unique chance for us as advocates to provide valuable education and support. But I want you to understand these challenges, and by addressing them head on, you'll position yourself as a trusted resource for families, for policyholders, and for your referral partners. So here's what I'd like you to understand. First of all, seniors who bought policies years ago don't have a clue what they really have in their possession. They don't understand how to utilize that policy. They don't understand how, what it takes to activate the policy. Sometimes they just forget they even have it. It's really sad. So they just don't get the benefits. The next thing is families have no clue about the benefits that their long-term care or that their loved one has in these policies. Okay, so definitely need to be educating them. Healthcare professionals, those folks that we call on every single day, financial advisors, your referrers don't understand long-term care insurance policies and or how to help their patients activate them to pay for the care that they need. And then to build on that, your referrers, particularly your healthcare professionals, don't regularly assess and identify patients who have policies. It's something as simple as at admissions asking them, do you have a long-term care policy? They're not doing that on a regular basis. So we're going to fix that. And then finally, communities don't have trained experts who can advocate for patients and families to help them activate their policies. Well, this is where you come in, right? There is an incredible advantage in positioning yourself as a dedicated senior care advocate. So while your healthcare professionals that you call on shoulder the responsibility of delivering quality care and navigating many payer sources, it's very, very daunting for them. And to learn about long-term care insurance policies, they just simply don't have time. All right, so you're going to be able to set yourself apart by positioning yourself as the expert who your referrers will happily call on you to help their patients because they don't have the time to do this. And you're going to be able to really position yourself as the preferred provider for these patients who have long-term care policy. All right, so your role as a long-term care advocate is going to help seniors and their families navigate these complexities of these policies and ensure that they maximize their benefits, right? We talked a lot about that in the first 3 sessions. So you'll be able to conduct a policy review and education. So you're going to be able to help those policyholders understand their coverage, including their benefits. And so you'll be able to do a broad overview of the policy, but then you'll be able to refer to our specialists for a more thorough review of their policy. So you're going to have that incredible service to offer. You will be assisting with claims by submitting the necessary and accurate documents on behalf of your families. You will provide the care coordination, ensuring that they get the care that they need that meet the policy requirements. Financial advocacy, ensuring that they utilize their benefits effectively to reduce their out-of-pocket expenses. And then assisting families in urgent situations to quickly access their long-term care benefits. Okay, so you'll be able to educate them quickly. And if they've already got through their elimination period, we can activate that policy. And then, of course, the provider collaboration. This is where you'll be able to partner with your referral sources and help them facilitate smooth transitions from hospital to home for those patients that maybe couldn't normally have afforded this. So by serving your community as a trusted resource, being that long-term care advocate, you're going to help families and your referral sources, and particularly those policyholders get the care that they need and that they deserve. All right, so your expertise is going to differentiate you. We're going to be marketing that like crazy. And by educating policyholders and their families and training your referral sources as well as positioning yourself as that community expert. You're going to build trust and create lasting value while increasing access to care opportunities. And that's what this is all about. So, what seniors want to know about long-term care insurance? Through the years of hosting many, many seminars with policyholders, I've identified some key questions that they really want the answers to. And these are questions that I actually use in my promotion of a seminar to draw seniors because they're eager to get the answers to these questions. So here are many of the questions. What does my policy actually cover? When can I start using my benefit? How do I file a claim? What services are eligible for coverage? What happens if I stop paying my premiums? And many of the others that I have here on the screen. Having completed the first 3 sessions, you now know the answer to these questions. It's so exciting. You can actually go, yep, I know the answer to this. I know the answer to that. This is knowledge that puts you ahead of 99.9% of the population. So it's incredible. And you'll see the impact that these seminars have on these policyholders. In fact, you're going to have an opportunity to watch a couple testimonials from some seniors who attended a seminar I had not too long ago. All right, well, why don't people activate their long-term care policy? Despite having valuable coverage, you're going to find that many policyholders don't actually activate their policy. And I'm going to take you through some of the misconceptions as to why that is. But here's some, the top key reasons. Number one, lack of understanding. They don't fully grasp what their policy covers or how to file a claim. The second one is living in denial. Many believe they don't need the help and they delay action until it's too late. And then the third one is misconceived notions. There's a lot of myths around coverage limitations or fear of claim denial that may prevent people from getting the benefits. So understanding these barriers are going to allow you to address concerns proactively as you're out there talking to folks and help families access the care by overcoming some of these issues. All right, so here are some of the policy misconceptions. And I've heard all of these many, many times. And when I really help educate, I can help them get through these or get past them. The first thing is if I start now, I'm going to run out of money. And honestly, over the years, I can't even tell you how many times I've heard this. The truth is that 50% of policyholders will die before ever using any of their benefits. The other statistic I want you to be aware of is of those folks that do activate their policy, 70% of the policies end because the person passed away, not because their policy ran out of money. All right, so what does this tell us? It tells us that people wait too long before they activate their policy, and they're leaving all this money on the table that could have been used to receive care and got the care sooner. So I always encourage people to get the care that you need now. Don't wait, and then share these statistics with them. I do in the seminars, and by the way, you're going to be getting a full PowerPoint presentation that you'll be able to deliver. And I touch in the presentation on these misconceptions. So you want to share with them. And when they think, oh my goodness, I've been spending all this money, and I'm talking big premiums, $600 to $800 a month for these long-term care policy premiums. And the really cool thing is once they activate their policy, typically those premiums stop. So a little bit of care earlier on, A, is going to stop that monthly premium, and B, keep them protected. All right. Another misconception is I'm not sick enough and my policy isn't going to pay for benefits. Well, the truth is that the bar to getting a policy started is much lower than people think. And I've talked about this in session 1. They do not have to be bedridden or require 24-hour care to be eligible. In many cases, standby assistance is enough of a trigger to activate a policy. There are 8 million active policies in the United States, and only 300,000 of them are actually being used, okay? Studies show, however, that in reality, 4 million people are qualified to begin their benefits right now, and they don't realize it. And isn't that sad? They have no idea that they're at the point where their policy will start paying for care. So that's going to be a big part of what we do is educate people about this important point. Remember, I said that 70% of people over the age of 65 need daily assistance at some point in their life, right? And I also said that only 20% of them can actually afford it. Well, you're going to encourage seniors to use their policy sooner than later because later may never come. They're in an advantaged position. They actually have the funding to receive care. So we want them to utilize that. All right, another misconception is, oh my goodness, and boy, have I heard this 100 times. Well, my wife helps me with that. That's enough for now. Or it might be my daughter helps me with that. And so many times I've had to advocate on behalf of the family caregiver. Okay. Statistics show that a spouse who is providing care predeceases the spouse who's receiving the care 60% of the time. Guys, I can tell you over the years, I have seen this time and time again. And I shared with you a real life case study in session 1, where the father who was providing care to mom was doing so much and he had an unexpected heart attack and died. And these kids they literally never forgave themselves for not recognizing the burden that dad was carrying and how unfortunate they felt that they didn't use that long-term care policy earlier that may have saved dad from all that stress that could have potentially triggered the heart attack. So it's not surprising when you consider the stress that these folks carry and why we might see these statistics that they predeceased their loved one, because typically they're around the same age, right? And we have cases where 80-year-olds are taking care of 80-year-olds or 90-year-olds, and they may be suffering from their own health issues, and so that additional stress and burden of taking on someone else is somebody else's care, particularly personal care, where it's physically very taxing. It can definitely take a toll. So this is something that you want to address with families gently, of course. But again, you are an advocate, right? And it's important that you advocate for the family member that is carrying that burden. Help the kids understand this is not good for your dad. And it's not necessary because they've got a policy. Let's utilize that policy to get the care going, lighten the load on dad. He can go back to being husband. We're going to do the care piece. All right. So helping families navigate and optimize their long-term care insurance policies unlocks greater care hours for you. It also reduces the financial stress, right, on the families. And of course, improves overall quality of life for everybody involved. So these are the things that you'll be able to do to increase your hours. First of all, through that policy review and optimization, you will unlock every opportunity that they have to pay for your care. They may have a special waiver that allows for additional home care services over and above personal care. So that could add hours. Most people don't know that, and certainly the insurance company isn't telling them that. You're going to help them with navigating the elimination period. So strategically using home care to bridge gaps before, say, benefits kick in. As a matter of fact, literally this morning in my office, we got a call from an executive director at an assisted living facility. They have a client that they want to admit, but they have no room. So the dad is taking care, or the husband rather, is taking care of the wife, and he's so burned out. And so this is why they're trying to get into the assisted living and actually her into memory care, but there isn't any room. So he recommended us. He mentioned that he's got a long-term care. He knows about our policy review. He had already talked to the husband about it. And we're going to hold him at home, provide the care, and alleviate some of that burden that the husband is dealing with, and be able to help them get through those elimination periods much, much cheaper than, the $7,000 a month that he would have been paying if he had admitted her right away. And so we're probably going to get 2 to 3 months of care at home before she transitions to the assisted living facility. So here's a great opportunity of how partnering with these folks, when they recognize the benefits that you can bring to their clientele, you are going to be the only call they make. I can tell you we are the only call he made this morning to help with that particular client of his. All right, so leveraging all available benefits, ongoing support and advocacy. So you'll be able to adjust care plans as the needs evolve, right, to maximize the coverage. So maybe they only need $100 a day or whatever, it might be $200 a day, but their policy covers $300. Do a supervisory visit, set an action step in your calendar to follow up and do a supervisory visit, revisit, is the care adequate? Is it time to add more hours to maximize that full maximum daily amount that they are allowed? All right, so that's just some ideas to give you to how to help increase those hours. All right, marketing your expertise. Now that you've gained valuable insights into long-term care insurance and the advocacy that you can provide, it's time to put your knowledge into practice. So you're going to position yourself as that trusted resource by educating the community, building referral partnerships, and showcasing your expertise to attract more clients and provide more meaningful support. So targeting your efforts are going to be in two key areas. Okay, the first one is marketing to referral sources. So here you'll position yourself as the expert, and you're going to encourage your referral sources to identify those patients and or residents who have long-term care policies. Okay, you'll brand yourself, promote your certification by using handouts, your flyers, brochures, all of those things, educational events. We'll talk more about that in a minute. The second is to market to policyholders and their families. All right, so you'll be able to provide presentations. You're going to educate policyholders when you're doing your assessments and motivate them to start care sooner. You'll be able to provide step-by-step guidance to seniors and their families, and that's going to be a value add that will help you build long-lasting relationships with these families. I'm telling you, the loyalty that they have to you once you do these policy reviews, and because you understand and have helped them unlock these benefits, they are going to respect you and appreciate you on a level you have never seen. And I could tell you 100 stories. I can't wait for you to experience this yourself. All right. So let's dig into marketing to referral sources, okay? And I want to start with positioning yourself as the go-to long-term care expert. Now, establishing yourself as that trusted long-term care authority is going to require consistent reinforcement, okay? So you'll want to share your expertise at every opportunity and in every interaction. It takes 7 exposures for somebody to remember a message, for a message to stick. So you want to make your expertise part of your brand identity. Everything you do, you want to be sure that you're talking about that, all right? Now, it all starts with an elevator pitch. So I want you to really create this for yourself, where whatever opportunity you have to introduce yourself, you're ready to do it and be able to really highlight this expertise. All right, and an effective elevator pitch is kind of concise, right? So it's something that you would imagine saying before the elevator doors open. When you get on the elevator and before they open, you've told somebody exactly what you do. But it highlights your expertise and the unique value that you provide. It differentiates you from everybody else out there. So imagine when you're out at a networking event and everybody stands up there and they say, I am a home care provider and I assist seniors with their activities of daily living. No, that is not what we want to do with this, okay? I'm going to share with you an example of something that you could do, say, at a marketing event or a networking event. So I'll give you an example and I'll give you an actual script, and then I will show you a little video snippet of me delivering that. But this is your opportunity to make a memorable first impression and spark their interest. So let's break this down. What are the essential principles to craft your winning elevator pitch? All right, you want to start with a hook. Capture their attention with a question or a statistic. Clearly state who you are, so introduce yourself, and then define the problem. So highlight what the main pain point is. In this particular case, we're going to be talking about how the complexity of insurance make it really difficult for policyholders and their families to navigate so that they actually can utilize their policy for the care that they need. All right, so you're going to then present the solution. The solution is you as the advocate. All right, so you're going to demonstrate your value and make it as authentic as you possibly can. All right, here is an example of a script. All right, and you'll be able to download this, by the way. But as you can see, I've got some key points in there. I start with a statistic to really get their attention. I then, explain how I can help. I'm stating that there's a problem. There are 8 million policyholders in the country, and an estimated 4 million people are eligible for care, but they don't realize it. So as a long-term care advocate, I am dedicated to educating families and policyholders about how to begin a claim and basically get the care that they need. So a little bit more there. There's an actual script for you, and I'm going to demonstrate this in a video, so you'll be able to watch that here after this session. All right, so this is really key. You'll want to make this your own, put it in your own words so that you can spit this out at any given time. All right, so be sure to watch that elevator pitch. You'll have an opportunity at the end here. Okay, so who to target? So now it's time to zero in on the key influence centers that will deliver the greatest return on your marketing efforts here. Okay, so what do I mean by influence centers? These are the strategic places that I recommend you visit for maximizing your reach and your referrals. All right, so we've got some healthcare influence centers, so like hospitals and rehabs, independent living communities, assisted living communities, home health companies, hospice companies, associations and organizations, financial professionals, and doctors and medical clinics. All right, so we're going to call on people within these centers who engage with seniors and their families, and you're going to be highlighting your expertise in navigating long-term care insurance systems and securing coverage for your patients. Okay. Now, building and sustaining relationships with key referral sources does require a structured approach. All right. And the 52 weeks methodology really does help systematize your marketing efforts to ensure that you're strategically connecting with the right people and that you're consistently communicating a message that keeps you top of mind, as well as sharing resources and insights that help you articulate that value add that you're bringing to the table. All right, so let me just walk you through this methodology that can really transform your marketing efforts as you get out and try to develop relationships with these key influence centers, okay? So the methodology is really, it's a business-to-business marketing system. And by the way, if you ever need more information about this and interested in looking at our system, you can reach out to us any time and we can walk you through this. But anyway, here is what this whole system is based on. It's based on reach, frequency, consistency, and accountability. So reaching the right people, seeing them often enough, that's your frequency, with relevant and helpful information. And then through consistency, you build trust by solving problems that their patients or residents have, and then holding yourself accountable, setting clear objectives and holding yourself accountable to those objectives, whether that's I'm going to see all of these key targets this week, and these are the number of people I'm going to see, and these are the number of referrals I'm going to generate, etc. So setting yourself up with your plan and then holding yourself accountable to your plan. So that is the methodology that we use with our system. Now, when it comes to focusing on influence centers, I think that right now, if you're just getting out there and promoting your advocacy, you want to focus on the healthcare influence centers. These are the low-hanging fruit for you, right, when you hit the streets, okay? So you should be targeting these key influence centers: hospitals, rehab centers, home health companies, anybody that does any sort of house call services like nurse at home. We're seeing in our area a lot of doctor visits at home kind of companies. Any geriatric care managers, hospice companies, independent living communities, assisted living communities, memory care, and physicians particularly who have a geriatric focused practice. All right, so you should be targeting about 30 to 40 of these influence centers. All right, and a lot of people ask me, well, how do I break that down? Here's how you might want to approach it. So at least a couple of the hospitals in your areas, every rehab center that you have. And I'm going to talk about how to qualify these influence centers in a minute. But pretty much every home health company that you've got, as many as you can target. But if you can, if it's just you want to be as focused as you can. So take a realistic stab at this and say, okay, I'm going to put in my database 5 home health companies that I'm going to target. 5 hospice companies, 5 independent living communities, 6 assisted living communities, and so on. So this is just a little bit of a roadmap to help get you going. All right. Now, within those influence centers, you need to target the right people. So back here, when we were talking about your targeting, this is your reach. Here we're talking about also about your reach. Okay. So who within those influence centers you need to target. So your discharge planners, social workers, the administrators, like that executive administrator that I just told you about at that assisted living and memory care center. The doctors, nurse practitioners, therapists, directors like social work directors, PT directors, etc. All right, so those are the key folks within those centers that you want to target. Again, that is your reach. And then you need to see them often enough to build awareness and ultimately build relationships that lead to referrals. Okay, so it takes several meetings. It takes several times for them to see, oh, wow, this person's consistent. This person's really here to solve problems for my patients. You get the first referral, you follow up, you build that relationship, you get the next referral, and so on. And so this comes with frequency, frequent touch points where you're in there and you're building that relationship. All right, so that's reach and frequency. All right, so again, you're going to select 30 to 40 influence centers, and then you're going to go prospecting, okay? So at least try to target 2 folks within those influence centers. Try to get a meeting with them. Schedule an appointment if you can. Drop by, do whatever you have to do. If you have to go to that center, you don't know who to target, go there, get to the front office and just start taking cards. Get who is the social work, who's the director of social work, get their name, get their phone number. Start building your database that way. All right, when it comes to qualifying influence centers and referrers, here's some criteria to consider. All right, so when you call on these centers, if you haven't been there before, you ask yourself these questions. Do they have clientele that needs my services? Do they have clientele who can afford my services? And in this case, maybe they would potentially have long-term care policies. And can I gain access to the referrers for regular visits? All right. So if you've got to narrow it down, focus on the influence centers where you can answer yes to those questions and, really hone in on those particular buildings. All right. Now, I believe that rehab centers are the lowest of the low-hanging fruit. Okay, so they tend to be a little more open to visitors, and there are a lot of people are a lot of referrers within one building who you can target. So if you can't get one person, you might be able to get another person, build a relationship, and then use them to connect you to more folks. So one position, though, that I see marketers often overlook when they call on rehab centers are the therapists. There are occupational therapists, speech therapists, physical therapists. The therapists work extensively with the patients in the rehab center, and they personally have a vested interest in that patient's progress. All right, their whole job is based on helping that person progress. They spend time every single day, sometimes 2 times a day, with these patients. So they build quite a relationship with the patients, and they're very aware of what their limitations are and what their fears are, particularly when they are beginning to think about transitioning home. So those therapists can be very influential in steering patients to solutions focused on their safety. They understand better than anybody what the challenges are this patient's going to face once they get home. So developing relationships with these folks that interface with your potential clients can really, really help you increase your referral sources or your referrals within a rehab center. Now, of course, social services is a key target also. They are typically the ones involved in the patient discharges, and they're the ones to make recommendations to families about what's best for their loved one and to give them resources. So what you're seeing on the screen here is a little breakdown of the influence center at the top, and then who you would target within that influence center and with what frequency. So you'll see your director of therapy, your therapists themselves, if you can be seeing them on a weekly basis, that's optimal. Especially the social services team, you need to be seeing them weekly. Director of nursing weekly if you can. The admissions coordinator weekly, and then the executive director perhaps monthly. So these are all people that you'll want to develop relationships with. Now, let me show you what I mean and the power when you have multiple relationships within one building. When we're working with our 52-week clients, we actually encourage them to own their buildings, all right? But it takes time. So you start with a couple of people in those positions that I just talked about. And as you get to know them, ask them to introduce you to other folks within the building. Now, I wanted to give you an idea of how this works. So my marketers who've been in the field for quite some time, they will literally spend 2 hours in one building, and they'll probably see between 5 to 10 people with just that one visit. So they're calling on a rehab center on a weekly basis, and they're seeing at least 5 people per visit. And this can take, a lot of time, but it's well worth it, because you think about these rehab centers, they are discharging 10 to 20 patients at least a month. So, you might be looking at 2 to 5 a week. And if those are coming to you, that's a great referral pipeline for you, right? So this is incredible. And now imagine if a family is hearing your name from 3 or 4 people that they interface within that building. Very powerful. I mean, you literally basically walk in and sign the paperwork. So very, very strategic in how you target the right folks. All right. Sometimes I see people targeting marketers at these buildings. And, it's one visit, it's a marketer, and you know what? That's not going to cut it. You need to get to the people that are engaging with the folks that have problems that you have solutions for. All right. And in this particular case, you've got something great to talk about with the long-term care policies. And now to make this task a little easier for you, you can actually download this great handout. This is targeting gold right here. Okay. This guide, it's called Influence Center Targeting Guide. You'll be able to download that after this session. And what it does is it outlines all the different influence centers that you'll want to target and who within those influence centers you need to focus on, how often, and then what's going to resonate with them so that you can start to craft your messaging. All right. So you're going to build some messaging based on what is important to that particular person in that role. All right. By the way, in lesson 5, I'm going to give you actual verbatim messaging for each of these targets that you'll be able to use with your long-term care advocacy message. Okay, so stay tuned for that. You'll have actual scripts that you'll be able to use. You can do it verbatim. You can make it your own, but at least you'll have a starting point so that you can tackle this really important part of the plan that you're going to have to sit down and take some time and really plan out here. Okay, so building strong relationships is essential in expanding your LTC advocacy and ultimately increasing your home referrals. So here's some strategies to position you as that trusted partner. So you're going to educate and empower. So obviously offering your long-term care insurance training sessions to these healthcare providers, along with easy to use guides that the policy holders will be able to utilize. You're going to have flyers to actually encourage them to give to policyholders to recommend your services and schedule a policy review. All right, strengthen your professional relationships. So building those partnerships with your referral sources using your branded tools, and you'll be able to really collaborate with them, leverage digital and social media. So if you can start to post some of your success stories and testimonials, that's going to help. Use LinkedIn and professional networks to, again, highlight your expertise here. And then finally, offering that seamless support and accessibility. All right. You're being that go-to expert. You're going to basically take all of those issues and questions off the shoulders of your referrer and be able to guide families through this to the point of care. Okay. So you're going to build some really strong referral pipelines utilizing some of these strategies. All right, well, let's take a look at marketing to policyholders and their families. And your conversations about long-term care advocacy really begins during the inquiry call. So this is what's really going to differentiate you from other agencies that they might be calling, because you're going to be able to say, look, have you got a long-term care policy? Well, you've called the right place. We're actually long-term care advocates, and then you'll be able to go on and talk about your services. That is incredible differentiation from anybody else they'll be talking to. Also, during your assessment, you'll reinforce your expertise. You'll actually be able to demonstrate your knowledge by guiding them and then perhaps scheduling a thorough policy review with our specialist. That's going to really differentiate you. And then finally, public events, holding those seminars that are going to educate policyholders in your community. So key marketing strategies for reaching these policyholders and their families. We'll do this through educational outreach. So you'll be able to host and work with some partners in your community to host seminars and webinars. You'll have some incredible guides and FAQs to hand out, again, to just continue to build your brand. Through your strategic partnerships, you'll be collaborating with healthcare providers and financial advisors, and they will be acting on your behalf to position you and, again, as we said, make those referrals. The digital presence and engagement, you will have lots of tools that you'll be able to upload to utilize for SEO, etc. And then community grassroots. So this is what I love, is working with churches and other types of organizations to host you in providing this education. And then also, of course, there are all kinds of senior expos and health fairs and things like that you'll be able to strategically use to communicate this key message. So through all these efforts, you'll be positioning yourself as that trusted long-term care insurance expert. And your whole goal is to make it easier for families to access and maximize their benefits so that they aren't one of those statistics, right? So now here is a picture of myself that I actually held a seminar not that long ago. And look at the audience. Do they not look like they're ready for care? And by the way, we must have started gosh, I can't even remember how many, maybe 10 clients from this one seminar by now. And this was held back in November. But you can see that we're getting the right people that are ready for care, and you're going to be able to educate them on all of the things that you've learned so far. And so I really encourage you to watch the testimonials. I think I've got 3 testimonials that you'll be able to watch after this session. So click on those and you'll be able to see these folks that attended. It wasn't actually this seminar, it was a different seminar. But these will be the kinds of testimonials you'll have, that you will be so proud to have helped and served and make a difference in your community. Okay, so let's finalize things here and talk about what we need to do to tap to success. All right, I like this acronym, TAP, targeting, action, performance. All right, so marketing your home care business along with your certified LTC advocacy is going to take some time, as I said, and effort. So I wanted to give you an outline to help you really sit down and start to put a pen to paper on this, okay? So the first thing is targeting, is identifying and focusing on the audience that you're going to target. So your influence center folks that we talked about, the message that you're going to use to position yourself, and then what community engagement you will utilize, senior centers, churches, and things like that, like we talked about. All right, when it comes to action, this is where we're going to actually start to engage and educate our audience. So it's time to develop that content, sharing your the educational piece. So again, you will receive a PowerPoint presentation, but you really need to help, educate yourself, practice all of those kinds of things. Then we look at frequent touch points. So meeting frequently and consistently to drive that message with your referrers and build relationships. Okay. And then schedule workshops, actually build a calendar of workshops that you're going to like schedule some dates that you can offer so that you can get them penciled in as soon as you have that discussion. And then finally, performance, setting goals, measure, optimize, and grow. Okay, so your goal setting is really important. Define what your objectives are, be specific, what those KPIs are, what do I want to achieve? How many webinars or seminars do I want to hold? How many referrals do I want to generate? How many clients, etc. And then, of course, you need to be tracking so you can measure yourself against those metrics. And then finally, measure your effectiveness and then tweak anything that needs to be tweaked if you're not achieving your objectives. All right. So, great little map that you can follow to begin to build out your plan. Now, you will have some awesome tools in your marketing kit. You will have this special logo that you'll be able to utilize on everything. You're going to have a specific brochure that's updated with the LTC advocacy and messaging. You will have a new business card template that includes that LTC advocacy. You'll have a general LTC flyer, and then you're going to have your presentation deck. One presentation will be focused on delivering it to policyholders, and the other one is to your healthcare professionals or referral sources, and some other great tools. All right, so those are coming. You're going to have those available to you, but right now you need to really focus on getting yourself structured for success. All right, determine who within your organization is going to be the dedicated person that will be out there marketing this program. Work on building your database of your key targets. And then with those targets, map out a routing system so that you can be consistently calling on these folks on a weekly basis or biweekly, depending on who you're calling on. And then, of course, develop that strong messaging, okay? Be sure it rolls right off your tongue, and then you'll have those materials to support that weekly frequency to build awareness, build relationships, And then ultimately be sure you're tracking all of that activity and holding yourself accountable. You may be using the 52-week CRM. If you want information about that, we can help you with that. All right, well, here we go. Next steps from here, y'all. You want to review the Influence Center Targeting Guide, go through that with a fine-tooth comb, review the elevator pitch and make it your own. So create your own elevator pitch. Watch the testimonial videos and then complete the quiz. And again, you need to achieve 80% to pass the quiz. And once you do that, you'll be able to move on to session number 5. So until then, bye for now.